This is a contrast CT scan of abdomen and pelvis of a 57 years old female patient. The patient was diagnosed to have left renal multiple calculi and pyelonephritis. Left nephrectomy was done. About 7 days later, the patient started having initially pus discharge and then still later the feculent material from the site of incision. Rectal contrast medium was also given to this patient. Now this is the urinary bladder. This is the contrast medium in the rectum here. Now this is left ureter and there is a calculus in this is left ureter, vesico-ureteric junction. This is a calculus in the pelvic part of left ureter. Now this is the left ureter when I trace it upwards. Per rectally introduced contrast medium. Now there is a perforation at this level and the contrast medium is coming out of the lumen of the descending colon. It then extends laterally through this tract. Air lucencies are also present inside it, and the contrast medium extravasates into subcutaneous tissues and then out of the site of the wound. Marked infection and inflammation are present in this region of renal fossa. Left psoas muscle is enlarged. Quadratus lumborum muscle is enlarged. And infection and its inflammatory reaction spreads upwards along the posterior surface of the spleen, involving the tail of pancreas as well. This is the coronal scan. Please observe marked infection and inflammatory reaction in the region of the left renal fossa, perforation of the descending colon probably at this level, and the extravasation of contrast medium into pararenal space and then outside through the sinus tract. So the patient has developed colocutaneous fistula. On histopathology, the patient was having Xanthogranulomatous pyelonephritis on left side. This is the sagittal scan. Same findings of colocutaneous fistula. The air in the tract leading outside onto the skin and the extravasating contrast medium.